Dr. Randall, the Soul Doctor, author of Soul Doctoring, Heal Yourself, Heal the Planet, shares her 40 years of experience as a cross-cultural practitioner, medical futurist, and expert in 20 different modalities of healing, along with amazing interviews with some of the leading minds in medicine and big thinkers in all walks of life. The stories of our lives are the woven energies of our soul's paths. They feed and ignite the spiritual light that nourishes the universal soul, the one mind, the cosmic consciousness where we all come together. This podcast is going to be a deep dive into the personal stories of people who have made significant contributions to the planet. What formed them? What moved them to become these leaders and innovators that inspire us so? Hi, Andy.
Hello.
So good to have you. We had a little back and forth bouncing around with differences between time zones, East Coast, West Coast, but we did it.
We did it. Here we are.
So thrilled, really, to have you. You got my interest. I think Glenn Brooks first told me about you, and anybody that combines as many different disciplines and things like you do, it gets my interest because, that's my sort of thing from way back. I was one of the first people to do, what was then something, that got me on shows that called The Other Side, where people were struck by lightning or seeing ghosts because I did integrative medicine. So that's how long it's been, and that's how weird it was then. But that's something, as I always have felt, that it's the combination of things where the power is. And you are a wonderful example of that. You're also a wonderful example of the kind of people I like to have on this show. You're an innovator. You're a game changer. You've done things that no one else has dared to do, and you've succeeded. And it's just a beautiful thing that you've done. And I want to talk about it. But first, let me introduce you, if I might. So
Absolutely.
Andy has done many things. He holds so many high positions, but basically he's one of the first people to do holistic integrative ophthalmology, and that's sort of an understatement. He leads the field in something called Chinese medical neuro-ophthalmology, and he has a master's degree in traditional Chinese medicine, which he got here in this country at the Pacific College of Oriental Medicine, but then he went to China, and that must have been really. How long did you spend in China?
I was there for a few months. It was postgraduate. Probably about 20 years, maybe 21 years ago. I think it was 98 or 99, a while ago, but very, very cool.
Before anybody else was doing that, one of my good friends and innovators also, David Eisenberg, back in the day, he went to China. But anyway, so that was amazing. And then I can't even say this college. Can you say it for me? The
Zhejiang College.
Okay.
In Hangzhou.
Okay. Where is that exactly in China?
It's in a beautiful, beautiful city called Hangzhou, China.
Mm-hmm.
They're famous for their long tea. They have a special type of tea, green tea, that they have there that they're famous for. Very, very beautiful.
Wow.
City.
Can you still get a hold of that here?
Say again? Yeah. You can. It's easier to get now. Maybe 20 years ago it wasn't so much, but we brought a lot back. And I've actually have some patients who are Chinese and go back and forth from China. So one's pretty close to Hangzhou, so I have them bring me back tea.
Oh, lovely.
They come back.
Yeah, they have great tea, and we all know how good green tea is for you.
Yeah.
So he's a guy, he had this vision to do that, and we're going to find out how that came to him. And he showed that it works, but what is even more profound about his path is he not only showed it worked in his own hands, he's showed academically that this works, and he treats chronic eye diseases that are otherwise considered to be untreatable, like retinitis pigmentosa, some macular degeneration, with acupuncture and sometimes herbs, right? And he did the first studies at Johns Hopkins, and then it was so successful, they did a second round of studies at Southeastern University.
Yep.
And it's just showed to be extremely, extremely successful. I must admit, I had to read your books, or at least the couple, and I tried it on the 8-point acupuncture technique on a few of my patients with retinitis pigmentosa, because of course their doctors didn't know what else to do, and they did have improvement. So
that's great.
Thrilling. Yeah, very thrilling, especially for the patients. He's written, co-authored at least 6 books on ophthalmic acupuncture and Chinese medical ophthalmology, including Healing Your Eyes with Chinese Medicine, Ophthalmology in Chinese Medicine, and Acupuncture Treatment for Retinitis Pigmentosa, Acupuncture Treatment for Macular Degeneration, Acupuncture for Treatment of Glaucoma, and the Black Book of Microacupuncture 48. What is that?
That's glad you asked. So that's a system. That's the primary system that we use in clinic. Acupuncture has got all these different types of systems. There's body acupuncture, as you know, there's ear acupuncture. Microacupuncture 48 is another system that I developed that's specifically used for treating eyes and neurological conditions.
Awesome. When did you have time to do all this? And then the last book, 48 New Acupuncture Points to Unleash the Power of Healing. I love that.
Yeah, that's the Microacupuncture 48.
You sit on like so many boards. I don't know how you have time to see patients. He's like, the go-to guy, for acupuncture and apparently for boards as well. So he's... But what is really cool about Andy integrates Chinese medicine, functional medicine. So you did the whole functional medicine?
Yep. Functional medicine, naturopathic medicine, and Chinese medicine.
Awesome. That is so awesome. So I'm your sister there with that. And
yes,
I love it. Okay. So here we are today, and you must be very busy. You must have lots of patients. But what's your biggest passion right now?
In clinical practice, we're exploring, so we've done the acupuncture, we've done Chinese herbs, we've done a lot of therapies. So there's 2 other therapies that I'm really exploring right now. One is we're doing a lot of work with hyperbarics with our patients, especially with eye strokes and retinal hemorrhaging and bleeds and things like wet macular degeneration or macular edema, which is fluid on the eye. So we're seeing some really great results using hyperbaric. That's something we added recently. And the other thing that we've been working on is alternating current stimulation, which is a form of microcurrent stimulation. There's been a lot of research in Germany over the past 3 to 5 years on that. So what I've been working on over the last year, we all had COVID, so we had a little bit of downtime. So I was trying to see what I could do at that time. We're actually working on a home unit for people to be able to use an alternating current microcurrent therapy at home as part of a home care treatment. One of the things that we realized through COVID is that there are travel restrictions. Not everybody could get to our office. So we wanted to create a system that was more home user friendly. So people can take some supplements, do some exercise for their eyes, and then also zoom out and really do a whole body healing as well.
How do you apply that?
It's actually pads you put over the eyes. So they're like little sponge pads that you put saline solution on, and we put them over the eyes, and they stimulate them for about 20 minutes or so. They do it once a day or even 3 times a week. And it's frequency specific. And what it does is it dilates the blood vessels around the eyes, wakes up the nerve cells around the eyes, stimulates the whole visual cortex and the whole visual system. And it really also helps with the metabolic waste that accumulates in the eyes, as you know, with like macular degeneration, even glaucoma is accumulation of fluids in the body. Retinitis pigmentosa, there's accumulation of pigmentation and rhodopsin in the eye. So a lot of these eye conditions is due to a buildup of metabolic waste and toxins. So a lot of the treatment has helped to facilitate what's called the Bruch's membrane in the eyes to break down and get rid of the garbage that the body can't. It's not doing it very efficiently. So it's a way to just keep the blood flow going, keep the eye health optimized.
So it's working on the microcirculation. Is that correct?
And stimulation. The blood flow and the stimulation of the nerve cells.
So is that something like these guys have these things called beamers, or they also have other ways to apply that? But that's more electromagnetic.
It's similar. It's more electro, and it's electrotherapy. And the reason I like it is because it has a lot of research behind it. I'm trying to, it's harder to, as you probably aware, it's harder to pitch things that there's not a lot of research. They're interesting, but the medical community is always like trying to get behind things that have research and evidence-based. So I did a lot of research on that. But yeah, it's of that nature. It's tuning into the body's specific frequencies for the eyes and the brain, the visual system, as an electrotherapy.
I love hyperbaric. I mean, when I had surgeries, I had 7 cancers come all at once because my immune system took a dive after a sewage spill in my house. And after surgery, I went into the hyperbaric chamber, and my doctor couldn't believe it. He's like, "What are you doing? I was healing like at the speed of light." He never seen anybody heal that quickly because one of them was down to the bone. And it just, like, before your eyes, you could almost watch the healing. So how does that work in the eye?
Well, hyperbaric is, as you know, basically you're breathing in oxygen. Our normal air is about 20-21% oxygen. And when you put a mask on, you're using a oxygen concentrator, you get about 98 to 99% oxygen. Then you go in hyperbaric, means you're increasing air pressure. So what that does is it increases the atmospheric pressure, similar to as if you're diving or going underwater, like maybe 10 feet or so. And the analogy I like to give people is if you've ever made your own carbonated soda, like seltzer or anything like that, they have the carbon dioxide cartridges, and you open that up, and the pressure inside the bottle, the gas goes inside and carbonates the water. That's exactly what happens with hyperbaric, except it's not carbon dioxide, it's oxygen. So areas of our body that haven't been able to get oxygen due to age, degeneration, poor blood flow, maybe the vasculature broke down and the circulation to that area is not so great. Maybe there's an old injury, nerve degeneration or vascular degeneration. You actually can get oxygen to those areas of the body by this kind of air pressure atmosphere where all the fluids in the body actually become oxygen rich. So they breathe. So in order for the cells to repair and regenerate, it requires oxygen because the oxygen is critical for the mitochondria to turn over. And you can't have cell regeneration repair or mitosis, cell division and repair without the presence of oxygen. So mitochondria's got to have oxygen to repair and regenerate and restore. So without that, repair and regeneration is not going to happen.
So you're just increasing the propensity to heal by driving oxygen into the cells,
you're amplifying metabolic activity. You're improving that process. So it's amazing.
It's amazing. I know they traditionally used for diabetic ulcers or burns or things like that, but I just love it, and it seems there's more home hyperbarics these days too. So do you combine that with other techniques, or do you want to do one or the other? Or
we take I like in my clinic, I like stacking treatments a lot. So we use things like laser therapy, acupuncture, hyperbaric, alternating current stimulation. Just in my 25 years of experience, I found that stacking treatments really does get the best results because you're just you're hitting it from so many angles. And, people are like, well, how do I know which one works? But when you're going blind or you're recovering from a stroke or, you're looking at, wound healing, you have diabetes and they're looking at amputating your foot, you don't really care which worked as long as you're seeing results.
That's what I say. But my patients ask me, well, how do I know which thing's working? I go, well, if it's working, why do you care? It's like you have cancer, and let's cure this. Right. So that's fabulous. So, that's really cool. So are you going to write any papers on the stacking treatments, or?
I do teach that. So I teach a lot of acupuncturists. Obviously last year with COVID, we didn't do as much teaching, but I usually travel around the world and teach. my next module I'm working on for training acupuncturists is more of a functional naturopathic medicine. I've been teaching acupuncture and Chinese medical ophthalmology to acupuncturists. I'm going to be expanding that. My next project for education purposes is to really integrate functional medicine, functional medical ophthalmology specifically, which includes hyperbaric training, in which atmospheric pressures I find better for which conditions and how long they take, and that whole thing. And just really kind of helping my students, like now that they're really locked into the Chinese medical side of it. A lot of acupuncturists do also practice functional medicine. Quite a few have interest in that because they complement each other really well. So I've had a lot of students inquire about that because they know that I do functional ophthalmology in my practice as well.
Oh, that's wonderful.
Yeah.
I love functional medicine. So tell me, when did little Andy, know that he was going to, branch off and do something amazing like this? When did you?
Well, I'll say it started in 7th grade. 7th grade, I went to a chiropractor with my mom. My mother was a massage therapist, and she worked as a massage therapist for a chiropractor. And my brother had scoliosis, so we're about 10 or 11 years old. And we went in, and the guy was really cool. He was, just out of chiropractic school in his 20s, and really just connected with him. So I remember in 7th grade, we had one of these business people come in, I can't remember the name of it. It was Junior Achievement. That was the name. Mm-hmm. So they came in, they said, what do you want to do is really, try to make a business card. And I was going to be a chiropractor. I just knew right then and there that I wanted to do, I liked chiropractor. I saw it work, and I was really interested in health. So up until high school, that's where I wanted to do. And then my father's an accountant. So I went to work with him in high school for a couple of years. And I decided that I was going to go to college for accounting. I did one semester of that and just wasn't a fit. I went right back to arts and sciences. And I was on a trajectory to go to med school. So my senior year, as I was studying for my MCATs and finishing up my exams, my father, I came home on break in December, and my father had told me that he'd been going for acupuncture for high blood pressure. He'd been on medications for 10 years, and he really didn't like the side effects and wanted to get off the medicine. So after about 6 months, the acupuncturist who was working with helped him to reduce his blood pressure. He lost weight. He felt great. And he was off the meds. And my father knew that I was into martial arts and that I was into this, pretty much into holistic. I was doing a lot of yoga then as well. He introduced me to Chinese medicine. He said, I know you want to go to med school, but check this acupuncture out. Why don't you go get it? Talk to the acupuncturist. I think it's something you'd be interested in. And that was it. I went, I talked, I got an acupuncture session. The acupuncturist gave me a book called The Web That Has No Weaver that I read.
Yeah.
And it was love at first sight. I was just fascinated with the whole theory and the Taoist philosophy. And I basically, at the end of the day, made the decision. I was like, the world may not necessarily need another physician, but it definitely could use another acupuncturist.
Awesome.
So
you knew you were going in the healing arts from the age of 7, but then you just followed your heart to get to here. And then how did you decide to, you could have just gone acupuncture and that's it. Why the eyes? Why the eyes?
Great question. So when I was in acupuncture school in San Diego, I always had an idea that I wanted to specialize. And I didn't really know what that meant. I just had an intuitive idea that it probably would have been a better business model to specialize. And at the time, I was really interested in allergies because I used to have horrible allergies all the time. It's, walked around with snot rags hanging out of my nose. I just felt it was terrible. I got a lot of help. I got rid of them from acupuncture. I was in acupuncture school. They abated, and I got rid of the allergies that I had. So as a lot of acupuncturists do, they get into a specialty of that which helped them. So I was doing allergies for a while, and I was getting great results. But I just
was that with acupuncture alone or herbs
acupuncture,
also?
NET. I'm sure you've heard of that.
Uh-huh.
Just allergy elimination testing, acupuncture, herbs, functional medicine.
Okay.
NET, anything and everything I could find that would basically help get rid of allergies. And I loved it, and I got great results, but I was just a little bored of it. Mm-hmm. So at the time, I've been working for about 3 years in the field, and I decided in 2000 to open my own clinic. And about 6 months in, I had this gentleman came in, who's an older gentleman named Manny Gordon, and he had glaucoma. It was pretty advanced, and he was obsessed with the idea that I was going to be able to help him get his vision back. Obsessed. Like totally obsessed. Like he was a stand for the fact that I was going to get his vision back. I knew nothing about ophthalmology. In acupuncture school, I only had 3 sides of notes. That's how little information we had on ophthalmology when I was in school. 3 sides, that's like 1.5 pages of every eye condition. Wow. So it was like maybe a little on glaucoma, a little bit on reading. So my work was cut out for me. He kind of challenged me to go out and see what I could find. And I love the guy. Like I genuinely wanted to help him. And he was like, "You're going to do this." And I'm like, okay.
And did you?
I did. So I went on a quest to find anything and everything I can about ophthalmic acupuncture and herbs and anything I could find that would help Manny. And back then I had a little bit more time. I wasn't married, didn't have kids, and I was able to travel a lot. So I went to China, I went to Europe. I was just on a quest, a vision quest, to help this guy. And after about a year and a half of compiling all the information that I had found and getting results with Manny, I started to become known. Other acupuncturists were asking me. It was before Facebook. I'm dating myself, or any social online stuff. But I was getting calls from other acupuncturists who had eye patients, and they had heard that I had some experience with this. So I started helping them and just giving them whatever information I had at that time. At which point I decided, hey, might as well just write a book, because I'm getting, so much inquiries, and that was the first book, Healing Your Eyes with Chinese Medicine, that I wrote about 18 or 19 years ago.
Wow. And how did you get into these chronic eye diseases? What made you think you could heal those? Retinitis pigmentosa and...
It was a mindset. So again, in acupuncture school, when I was there, one of the eyes was something that was not really exciting to a lot of my professors. They're like, I don't really take any eye cases. You're probably not going to help too much. So the curiosity for me was, hey, if I could get rid of people's headaches or help with their colitis or asthma or their allergies or, whatever they were dealing with, why was eyes so different? Like, why was it like taboo to treat eyes, or why couldn't I do anything? It's the same principles, the same body. So it was that inquiry that, hey, well, why can't we do eyes? So I started learning as much as I could from Western biomedicine about ophthalmology. I started doing a lot of self-study on anatomy and physiology and functional, just the whole Western biomedical. I had a great mentor and friend of mine who was an eye doctor who actually became an acupuncturist, Dr. Mark Grossman, who's a good friend of mine. And we kind of palled around. I showed him some acupuncture stuff. He showed me some Western stuff. And he was really is an amazing guy. And he was very instrumental in terms of making himself available for me to ask questions about medications and eye diseases and helping read test results and stuff like that. So I had a really good support system, and I had a lot of interest. So that was a good fertile ground for creating this specialty.
That's amazing. So are you telling me there really wasn't any information out there, like at least from a Chinese sense, that you could draw on?
Little to none. Most of what I had was, so the first book there was a lot of herbal medicine. That's what I was able to find. From the classics, there was a lot of herbal medicine, a lot of Chinese herb formulas. But in terms of acupuncture, wasn't that much. And Chinese medical theory, so a lot of what I put together was based on my clinical observations. It was like I check the tongue, check the pulse, and write down what I saw with different cases. And then after seeing hundreds and hundreds of cases, I'd start to look for similarities and patterns, what I saw in individuals. And of course, everybody's unique and individual, but I did start to notice some underlying patterns that were similar to people with glaucoma and people with retinitis pigmentosa and people who are dealing with retinal occlusions and strokes and diabetic retinopathies and dry eye. So they were all starting to reveal some of these deeper issues. Sometimes they were heavily mentally, emotionally driven. Some of them were autoimmune. Like RP is like, which you have treated a couple of cases yourself. It's rooted in autoimmune, and conventional biomedicine doesn't even have that conversation right now.
Right.
But I've seen it. I've talked to patients, and it's in the family.
It is in the family, and it seems to have a lot to do with inflammation. To me,
huge.
Yeah.
Yeah. It's
and I know when my patients are better and they come in and they're not red anymore.
It's true.
Yeah.
It's true. And they say other things. So like, hey, I don't get headaches anymore. My joints aren't as inflamed, or I digest food a little bit better. The systemic inflammation, because, we're talking about the eyes, but we have to zoom out, no pun intended. And I remind my patients that, you're here for the eyes, but these are systemic issues,
right?
Where conventional ophthalmology just, looks at the eyes and disregards, other than diabetic retinopathy, the rest of the body's effect on these conditions.
Right. Yeah, I always treat the inflammation in their whole bodies, and a lot of it comes from diet too,
100%. Dysbiosis, food allergies.
Alcohol.
Yeah.
Sugar.
Yeah, absolutely. Processed foods for sure.
But I just really respect you because you're like the founder. You're the founder of acupuncture for chronic eye diseases.
I would say the modern.
The modern.
I would say developed it. So I took. I'm pretty good at like taking information and compiling it together and delivering it.
Yeah, you remind me so much of myself. You're an applicationist, but you you did it first. So you're the founder in my book. Okay.
I'll take it.
No, that's huge what you've done. And think of how many people with these chronic conditions that wouldn't get help otherwise.
It's true.
And all these acupuncturists are coming to you now and they're learning it. That's really amazing. Thank you so much.
Yeah. Well, it's that's what I became a stand for. It was like, people have these conditions, they're going blind. Conventional biomedicine says there's nothing for you, which is partial true because there's no drug and no surgery. But that doesn't mean that is a medicine, not the medicine.
Mm-hmm.
So there's a lot that people can do, and it's not for everybody, but those who are looking for something that can help slow the progression and or recover some vision, there's a lot that can be done.
Yeah.
If people are willing to just open up and listen.
Yeah. And be patient and go for it. I mean, try it, do it.
Yeah. It's a self-advocate type of thing right now. Most of my patients are very, they're self-advocates. They advocate for themselves and they're just looking for whatever works, and the great thing about acupuncture and what we do and herbs and functional medicine, there's no negative side effects. It doesn't cause harm. Mm-hmm. The side effects are like you feel relaxed, you sleep better, your digestion's better, all these other systems, because you're balancing the whole body.
Mm-hmm.
So in addition to your eyes improving, everything else is going to follow along with that.
Yeah, that's just amazing. I used to account, I don't know if this is even, you can tell me, but I would count the number of points that bled. And as he got better, he had less and less points, or then finally no points that bled.
Yep.
After.
In Chinese medicine, that's with inflammation usually. Of course, You could nick a capillary, but generally speaking, when points bleed, it's because those points that we're selecting, there's more local blood pressure. The capillary pressure, there's a traffic jam. So when you're bleeding, you needle the points and some of them bleed, it's a release of pressure. So you're actually letting some of that local inflammation out to make way for better circulation to that area.
Yeah. It's just amazing.
It is.
I couldn't help myself, but I was also shocked that it worked.
Right? It's cool in theory. That I always marvel over that too. I'm like, Chinese medicine and acupuncture is so cool. It's even better when it works.
Yeah, right? Yeah. I have a little training in Chinese medicine, but nothing like you, but I just love it. So what was your greatest victory, do you think? Was it Manny or since Manny?
We've had a lot. And I'd say my biggest overall victory was I I would see these really challenging cases and kind of like, oh, I don't know if I could help them. And, just because I didn't have the experience. But we've had patients who've gotten their driver's license back. I remember one case probably about 11 or 12 years ago. I had a woman that I was treating for macular degeneration, and macular degeneration is like this. You really can't see your face in front of you. You could see peripheral, but everything's distorted in front of you like that. So I was treating her for macular degeneration. She had it for 15 or 20 years. And it had gotten bad and stabilized. And what she had was just a lot of drusen buildup in her eyes. And we used some herbs and supplements to break that down. Her macula was actually in pretty good shape, but the buildup wasn't. It was really accumulated there. So we got rid of a lot of the drusen, and she could. One of the things she told me is I could see myself in the mirror, but she started crying because she hadn't seen herself in 15 years. Who's this old lady I'm looking in the mirror? So it's bittersweet. So we've had so many stories like that where people have seen their kids, or I had a mom a couple years ago, finally throw a ball. She had a 5-year-old kid and they wanted to just throw a ball around, and just, it's the little things that, we talk about big victories, but in clinic, the big victories are the little things. I've had patients who've been fully blind, barely light perception. And look, they're not going to get all their vision back, but they could recognize shadows. And this particular gentleman was like, look, when I go in the shower now, I could see the shadow of my arms and my legs. And, I could see doorways, and he could get around, and just see his body and connect to the world and connect to himself again. Oh. So it's these little wins that accumulate. And at the end of the day, for me, it's really what matters to the patient. I love hearing their little wins, and it's lifestyle. It's well, I just want to see my kid, or I just want to see, I want to be able to get my license back, or I want to be able to play cards, or get on the computer, read books, or read music. I've had quite a few musician patients who just couldn't read sheet music anymore. Mm. And they were able to, read music or write and paint, do art. So those are, it's the passions. When you could restore function, independence is a big thing for people who are older, but for younger people too who are losing their vision, it's around family, kids, seeing people, because that's how we connect. We're visual creatures. So it's helping them with their passions and their connections. That's really where the magic is for most people.
That's so beautiful. Yeah. Thank you. So where does insurance pay for this, Andy?
It depends. So right now, it depends on the insurance company. Acupuncture does not cover for eye issues, but obviously insurance is kind of a game. So we have patients come in. Most people have some pain somewhere. If they don't, we can't make it up. But what we do is, say, for example, somebody comes in with neck pain. So we'll work on their neck and work on their eyes, and then insurance will usually pick up for pain. So, as long as somebody has legitimate some type of pain in their body that we're going to work on, we can treat both at the same time, and insurance is more likely to pick that up if their policy covers acupuncture.
So are there any initiatives, or do you have any plan? I mean, this needs to be part of the healthcare system.
Agreed.
Yeah.
Agreed. I was pretty, years ago, I was pretty big into acupuncture politics. I don't have time for it. I kind of been there, done that. But yeah, there's our professional associations are lobbying and working to get, healthcare inclusion. It's a process. I don't know all the nuances about why it's not included. The insurance companies certainly know it's more cost effective. Look, you can do acupuncture for a bum knee, which I've done many times, and a couple $100 help, maybe $500-$600 help people avoid knee replacement surgery versus a $40,000 knee replacement surgery. So the logic is there. It's just it takes time.
Yeah. I so get you and feel you, because we of course go through the same thing where a lot of the things that we provide as functional doctors, integrative practitioners, even though I'm, Western MD as well, and we play that sort of game you said, to get things paid for, but
yeah,
really it needs to be upfront. and central.
Absolutely.
Because people can be saved from having to go in the hospital, from having a long drawn out chronic disease, by changing their diet and giving them a few herbs and supplements and teaching them, how to live a better lifestyle. Now, which is more expensive, but we're just not there yet. But we got to
agree. I just think we're not there yet. I think it's an evolutionary process, and we're going to get there. As more people demand it, we have our patients who have any influence. We say, look, call your insurance companies. Just let them hear it.
And we need to keep shining our light as to what the actual truth is. And this is how people like Dean Ornish. It shows you can reverse heart disease, complete blockages of all coronary arteries. And then people are scheduled for surgery or heart transplant, don't end up needing it. Because they went plant-based or something, things like that, so we just have to keep shining the light.
It's true. Persist, just keep on it. That's what we do. And hey, that's how we got, the opportunity to do the research. Was we had enough patients who went back to Johns Hopkins and said, hey, we're getting results. 1 patient, 2 patients, whatever, 20 patients, 30 patients, 40 patients. Man, we got to take a look and see what this guy's doing. So they called up and they said, hey, we're interested in what you're doing. Would you be interested in doing a research study? So it's just people talking, like you said, it's just keep doing what we're doing and be persistent and clear. And that's it.
That's fabulous. So if you had a magic wand.
I do.
You do? Oh my God. So what are you going to do with it? What if you could change one thing to make it a better place to be, from your perspective, your venue, your viewpoint, no pun intended, what would that be?
I have to go back to what we just talked about. I think that so many people right now have the expectation that insurance and healthcare is going to cover for our services. So I would love to see, my wish would be for acupuncture, functional medicine, naturopathic medicine to be fully integrated into a, holistic, as they do in China. You go to China, like when I was in China, you go get your eye exams, you get the whole checkup, then you go to an herbal pharmacy, you go to an herbalist, they check your pulse, they check your tongue, they write an herbal formula, then you go get acupuncture. If you need surgery or an injection for bleeding, then you get that. But it's a very integrated system. Mm-hmm. So that's my vision. My vision is to have a fully integrated system where insurance is covered and reimbursement is, needs to be pretty fair too. There's that too, like I know I have a lot of friends who are chiropractors, even acupuncturists. You can't survive on $30 a visit. You know what I mean? It's just not, sustainable. So there needs to be inclusion and reasonable compensation for that.
Absolutely. I agree with you 100%. It's the same across the board, where we could, even Ayurveda or, India, my East Indian Ayurvedic teacher, he was the head of the integrated medical system for all of India, which was founded in 1952. Now, are we a little bit behind or what?
A little bit.
Yeah. So they've been integrating things for way before us.
Yep.
And, we need to get our stuff together. And although, their medicines are different. So, and a lot of ours are like yours are coming from modernity. So we need to put those new things we've found out together. And in this country, also regarding our food system and what's actually creating disease. And so everybody understands, and that's what we really need.
A little more transparency with the diet and foods. I agree with that too.
So we can all work together. I can say, oh, let's send you to Andy over there, and a lot more cooperative efforts. I like that too. It's not competitive, it's cooperative. So it's not like, hey, little the ego, you know what I mean? I'm sure you've seen a lot of that too. It's like, no, hey, well, I can't do anything for you. Go try this. I don't have anything for you, but consider this. It's not going to harm. And again, I think that probably has a little bit to do with the legal system. A lot of physicians that I've talked to, they quite candidly say, hey, look,
I love you, and but if I refer, say, for acupuncture for somebody I don't know, how do I know it's not going to hurt? How do I know they're competent? How do I know that I'm not going to get in trouble for making a referral where somebody got hurt? So I understand that from my Western biomedical buddies who believe in what we do, but there is some concern about litigation and practice, being sued and stuff like that. That's a thing now too. So there's a CYA mentality that kind of comes before patient care that creates a little bit of fear, I think, in terms of making referrals.
Well, we need more education there, because that's so sad. Because, and they could also educate themselves. Yeah, especially if they know you. I mean, I think there's very little risk with acupuncture, if any. What is the risk? I mean, it's like what, 0.0. I mean, we were taught this at one point, 0.01% or 0.03% or something like that.
Yeah,
risk.
I mean, you're good. You may get a bruise, and if you go to somebody who doesn't know what they're doing, who has no training, and they start needling out here, you get a pneumothorax. If they're taking a 3-inch needle and burying it, of course. But everybody who's trained or gone to school knows what to do and how to do it. All the needles are pre-sterilized, use them once. So there's no infection. You're not going to, the needles are as thick as a head hair pretty much. You can't harm anybody. Mm-hmm. You have some people who are needle sensitive, who don't really like it. But other than that, you can't really hurt anybody.
Exactly. Super safe. Safe.
And super effective.
Yeah. I love it. I like combining it with different things. You're a combiner. I love that about you. Yeah. I like combining acupuncture. Frequently, I combine it with a discipline I learned called orosoma, which is kind of a color essence. Also, it's also like an essential oil in a way. Mm. It has essential oils and gem extractions. So there are these beautiful bright colors. So you get a color healing, you get an olfactory, hit from the essential oil. Yeah. And then it's a vibrational. It's a very high vibrational, and it goes well with acupuncture, I found.
Love it. Yeah. Stacking treatments is really useful because you're just hitting so many different systems. Like you're hitting the limbic system, with the oils and different frequencies. And again, this, it's not always the one thing. It's like 2 or 3 things put together gets a better result than any one of them could do on its own.
Exactly. I love that.
Yeah.
So, what else do you want to share with us before I ask
Let's
you?
See. Well, there's so much that people can really do for their eye health, and it really comes down, like you said, nutrition's a big thing. So the 2 things that my patients talk about all the time, I hear this every week. Hey, doc, I started exercising, my vision got better. It just, things got brighter. Or I'm under stress, my vision got worse. Like the role of the simple role of managing stress and exercising regularly, and the effects not only on eye health and total health, but it's the simple things. It's the daily investments that we make in eating right, hydrating, managing stress, getting the right balance of sleep and exercising, and enough work that we feel productive and we contribute, but not overdoing it. So, Chinese Taoist theory has this, everything in moderation, including moderation, meaning there's this balance. So we have to, we don't have to, we do whatever we want, but the objective is to really have this, full spectrum lifestyle that we lead, where we have a full, happy life that we're eating right and taking care of ourselves. And, for some people it's big, like radical self-care it's a big investment, and it takes some time and it takes some planning. And it's easy to just, grab, a bagel out of the fridge and, or grab like a handful of chips or something like that. It's a little bit more work to prepare your food, to schedule workouts, to make time for yourself, to schedule meditations, to schedule date nights with your friends or your family or your significant other, your kids. Time will eat you up. The world will you got time. The world can give you plenty of stuff to do. Yeah. but really, making it a priority to practice, self-care, to make sure our tanks are filled, because there are plenty of black holes out there that can, suck our energy. So we really need these batteries in our lifestyles to charge up so that we operate and function ourselves, especially those of us like you and I who are, in the healing and healthcare industry. We're in constant demand. So I'm only as good for everybody else as good as I take care of myself. Mm-hmm. So if I'm not taking care of me, then how can I take care? My capacity to take care of other people is going to be reduced. I'm also a fraud because I'm not practicing what I preach.
Oh, I do. I practice what I preach.
Right, you have to.
So when I was a triple threat back at UCLA, that's when I got my real sort of take-home message. I wanted to practice martial arts, so I crossed off 8 to 9, Monday, Wednesday, and Friday, and I told all my secretaries of my 3 institutes I worked at, and I told them I have a meeting. I didn't tell them what the meeting was.
You had a board meeting.
I just said I have a meeting at that time. I'm not available. And so I went and learned karate, and I became a 2nd degree black belt, and then I learned samurai sword, my love. And no one ever asked me what that meeting was for. So the whole time that I earned those belts, and then I learned I can do this. I can have self-care, and you just have to make appointments with yourself and follow through. Don't break that appointment like it's with the president of the United States or
true.
Just you got to do it. I saw you on your boat. You take care of yourself.
Yeah.
Don't pretend.
I surf. I do a lot of surfing.
Yeah, don't pretend you don't.
Yeah, I work out every day, meditate every day.
I can tell by looking at you.
Full, yeah, but that's the way I like it.
Yeah. Good. I'm big into diet too. That's one of my big things is plant-based vegan diet. And I think that if we look around at the planet, it tells us what we're supposed to be eating.
Good point.
Exactly. And I'm going to give a talk on that on Friday.
Oh, wow. Can't wait to hear that.
Well, it's on Instagram TV, a plant-based vegan diet. What is good for us is good for the planet. Because everybody's so confused. What should I eat? Should I eat keto? Should I eat paleo? What should I think it's very clear what we should be eating. The more plants we eat, the healthier we're going to be. Right.
And I think to that, people get really confused about the protein. So I think, the big thing,
how do you get your protein? It's like, meet my friend, the silverback gorilla, who never touches anything but a bamboo shoot,
Yes.
The biggest mammals on the planet don't ever touch meat. I had an anthropologist in my office the other day, and we were just talking about food and stuff. She said, Dr. Randall, it's really interesting because if you really get into it and study it, our predecessors, our ancestors, mostly ate what they foraged and very rarely ate meat. And that's what I always say. So I felt very validated after that.
True. It's true.
So, yeah.
Diet is huge. And, food be thy medicine. That's
medicine be thy food, yeah.
Food and the digestive capacity. We have to take care of our gut. In Chinese medicine, they say that too. There's this 4,000-year-old text called the Pi Wei Lun, which is the treatise on the spleen and stomach, which talks about the critical necessity of having that's where their food becomes us, and our energy sources. So having eating the right foods and having a healthy digestive system is critical to optimal health.
Right. Great. So it's not only what you eat, but how you digest what you eat that makes you what you are. So
it's true.
There's a whole thing about that too. So anyway, that involves stress, and that involves, you got to, again, the self-healing and taking time for yourself, because if you get too stressed out, you're going to kill off all the good bacteria in your gut.
Absolutely. Break down the lining, get dysbiosis, leaky gut syndrome, which leads to eye diseases and a bunch of other diseases.
Right.
So the gut is the first, they say the gut's and your immune system. The immune system starts in the gut. So all my eye patients, we talk regularly about gut health, intestinal health, not eating when you're stressed out or when you're on the run, and respecting your food and just making better, healthy choices, valuing what you put in your body and, what you put in here too, in your mind.
Oh, I'm so glad you do that.
Diet fast.
I'm so glad you do that. I'm a gut doctor. I'm a gastroenterologist also.
Yeah.
So that's really important. So, I wanted to ask you what, if you could change something. I guess we already talked about the system. We already talked about how we would treat our patients.
Mm-hmm.
But, there's also, something about, education and how people receive our message.
Yeah.
So if you could change something about, the education that people receive, I personally think self-care is a good thing. Some people say, well, it's back to the me generation. But I think if people don't do self-care and pay attention to me, they're not going to get to the we. If they pay attention to the me, they'll get to the we, and then they can't look at a piece of plastic the same way. They will start noticing what else needs to be done and start respecting the earth and the animals and plants and things as part of the we, and the oceans and the earth, which we all need to do right now. And so what would your vision be about education and that kind of spreading the message?
You know what? I would take the news and I would swap out, all the stuff that's on it now for things like plant-based diets and immune health and cleaning up the oceans and relieving stress. I would flip the script on the news and make it a positive. Maybe it wouldn't get as much ratings, but there's more use value. Talk about good stuff and talk story. You could talk, you could create some drama around that. But
you should have the Andy Rosenfarb hour.
That's right. You got it. But just, to break the addiction to stress and drama, mm-hmm. and just, feeding into drama and stuff like that. And just the realization that we all have a choice, where we want to focus our attention on. And I would like to see more attention in the world, media, wherever, mm-hmm. Given to positive instead of like chaos and stress and what's wrong with the world. Talk about what's great about the world instead of what's wrong with the world.
Exactly. What if you woke up one day and say, what if nothing was wrong?
Imagine that.
Instead of worrying about which vaccine should I get, or, am I going to get this, or am I going to get another pandemic or whatever? Right. If we focus on the kind of things you're talking about, we won't get another pandemic.
It's true.
Because we'll be focused on healing our planet.
Correct. It's a different projection. It's a different intention. Yeah. Love it.
Yeah. Get everybody, I call it, pointing their sacred arrow in the same direction in a positive way. And that's what it takes. I mean, they've shown, scientifically, it takes 7,000 people thinking positively in the same way for a brief period of time to change the electromagnetics of the planet. You got less crime rate. You actually benefit the planet.
Wow.
Imagine if we get like everybody doing that, at the same time, or like more mass. It's called collective consciousness. That's what I'm all about.
It's a good mission.
Yeah. Well, that's why I have you on, because you have that message. So
I love your work.
Well, I love your work.
Thank you.
You're in the same. You're my brother or my son. I'm not sure which. So what's next, Andy Rosenfarb?
What's next? Well, I'm actually finishing up my second doctorate right now at the end of this year in traditional Chinese medicine. So I'm getting that done this year. And my goal, again, is I'm really working on trying to create this integrative wellness center focused on ophthalmology.
Oh, wow.
I'd love to attract, holistic ophthalmologist or optometrist that's really has a similar aligned vision that I have to really, I really want to create a world-renowned integrative. Now we have like a world-renowned acupuncture center for vision, but I really wanted to take that next level and be integrative, where people can come if they need cataract surgery, they got to get cataract surgery. If they want, kind of like the model of how they do it in China or India or like Singapore. Europe has a lot of it too, but really embrace and create this integrative type of facility.
I love it. Where's it going to be?
Not sure yet.
What are you going to call it?
Probably stick with AccuVision. Mm-hmm. Like the AccuVision idea, but if something comes up better, we'll do it. I like the AccuVision idea. Mm-hmm. But the idea is just, again, that integrative, where we have both Western and Eastern biomedical physicians,
I love it.
Naturopaths, functional medicine, master Chinese herbalists who could put together herb formulas. Maybe people do eye yoga and meditation, everything, full broad spectrum.
Fantastic. All right. Well, let me know.
I'll keep you posted.
All right, Andy. Anything else any words of wisdom you want to leave us with?
Focus on what you want. Everybody, just stop. Focus on what you want. It's very easy to think about what we don't like, what we don't want, what's not working. It's a simple shift. Just say, what do I want when it comes to our health, our perspectives? What direction are we going in? Where do we want to end up?
I love that. Some of my people ask me this: how do I know what I want?
Ask yourself. That's the meditation. Good question. I had that question quite a few times, and that's your meditation. The meditation is, I want to know what I want.
Uh-huh. I also tell people you can feel it in your body. You can feel it in your heart.
Yeah. And,
if you feel passionate and your heart rises up, that's it. Even if it's something you didn't expect, follow that path, because it's going to take you to the right path eventually.
Indeed. And you have to have the courage to walk that path, because it's not always comfortable all the time, right?
Exactly. Yeah. But you know it because, when you're on your soul path, because things start to magnetize to you, like, True. Oh, wow. I needed that. I didn't know that was going to happen.
Yeah, things start to line up. It's very interesting when you're in full alignment, like these coincidences and serendipitous moments just start to show up. It's pretty cool.
Yeah, very cool. You're very cool.
Thank you. You are too.
All right. Well, let's stay in touch.
All right. Thank you so much for this opportunity. It was so great speaking with you and to your audience.
So much fun. I'm Dr. Gail Randall, creator and host of Soul Stories. I just want to thank you for listening to my podcast. I recently got a notification from the International Podcast People, and I was astounded that so many countries are listening to my podcast in the category of alternative health. So thank you, and please continue to listen. I especially want to thank Egypt, Croatia, Japan, and Switzerland, also France and Ireland, because my numbers were quite high there. So keep up the good work and check out my Instagram at Dr. Gail Randall, and particularly check out my Instagram TV, where you can hear me talking about alternative medicine subjects and also see me. It's a very good show, and I think you'll like the subjects. It's on 6 p.m. Pacific Standard Time every Friday, but it's recorded there, so you can find it there anytime you look. Okay, thanks again. I love you guys. This is Dr. Gail Randall from Soul Stories, and author of Soul Doctoring, Heal Yourself, Heal the Planet. I want to thank Saltology, our sponsor, at bathsalt.com, which fits perfectly into my medicine bag as it, like me, calls upon the ancient wisdom and modern technology to heal, especially with the stresses and ills of our modern times. The Bokek brand uses organic salts combined with organic essential oils sourced from ancient Egypt to provide a perfect remedy for your bathing ritual and healing from modern stresses. The Relief RX brand is a unique one-of-a-kind healing salt that uses organic CBD, treated with a unique emulsification process to create nanoparticles which easily enter the skin to most effectively heal and relieve aching muscles and joints. Whether from chronic inflammation or just a rough workout, this is the perfect healing bath, especially when you add the organic essential oils of neroli, lavender, eucalyptus, or grapefruit. Your body, mind, and soul will be lifted and soothed like never before. Go now to bathsalt.com. I also want to give special thanks to Larry Antonino and Agora Borealis Recording Studio for music and score, and also to closetotheearth.com for IT and computer assistance.